Okay.
Almost there. Almost live.
Okay. So anyway, I'm going to try to get these things up on the screen to share, but I don't have them in the right order. But okay.
Okay. Oh, we're live.
Okay.
What were you looking to share?
Yeah. So I have a case that I've been working on for the last few months, and something else came up on it today, and I was like, "Whoa, we need to share this with a lot of people and have it be known," because this is just showing to me the damage that these flea and tick products do to the gut's microbiome. And of course, I can't document it because we only know 16 species that we can track in the microbiome. And so when we do put these flea and tick products on our dogs that we know are toxic to the fleas and ticks, what is it doing to the microbiome? You know, it's a systemic medication that is getting into their bloodstream, killing the fleas and the ticks, as well as heartworm preventative, like the Simparica trio. And here we are putting that into our dog for the whole month at a time. And what does it do to the microbiome? I think it absolutely obliterates it. I mean, just so if you have an animal that is weak gut-wise and has, you know, been managing itself, and you throw these flea and tick products on them, and then they crash. And I don't think the veterinary profession has paid attention to it. And I sort of want to go over a case that I had 10 years ago that opened my eyes to what the damage of these flea and tick products are to the gut microbiome. And then I have this case that I've been working with for the last 2.5, 3 months and been so excited about its care. And then the Simparica trio was given 3 or 4 days ago. Dog has all its diarrhea back again. So I wanted to talk to people about this, to think that you can put some type of a poison that has mechanisms of action to kill fleas and ticks is not somehow destroying species in the microbiome, is literally putting poop on your face and saying, I don't want to see anything.
Yeah.
And these are damaging. They're really damaging. And I think that, I'll read some of the statistics, but I'd like to sort of tell the cases and then let them see the new case I have. So the first case that I had was about 10 years ago with a dog who, Archie and Agatha, and I've talked about them, and I've published this paper before in a peer-reviewed journal. But both of them were wire hair fox terriers that the owner, who worked at Mass General and Mass College of Pharmacy, one of them worked at each one. So very intelligent people. And they had these 2 puppies, and they were blittermates, and they were trying to kill each other, or he was trying to kill her. She wasn't trying to kill him. And they had to walk them separately up, and they lived on the 4th floor in a condo. So walking each separately because they would try to kill each other is really challenging when you don't have an elevator. It's a lot of work. So they did that for a while. And both of the dogs, we diagnosed them as having the immune endocrine imbalance, or Plechner syndrome, which to me now means that their endocrine system is not balanced and they have very weak immune globulins. But that's something I learned over years. So we gave him, he was food sensitive to everything. He could only eat one source of protein. He had this aggression issue and terrible skin. So we went ahead and gave him a fecal transplant, and like in 30 hours, he could eat foods he could never eat before. And he was grooming his sister, cleaning her ears, licking her face, totally in love with her. And my shock was, there's precursors to oxytocin in the microbiome. There has to be, for this dog to have flipped from being so aggressive to something that was nurturing, very much like Lily, who was the donor, who was very loving and wonderful mother and loved everybody, was acting like a mother dog. And so the dog was doing great for 2 weeks and could eat everything. Everything was going along fine. She gives him his Innoceptor, and about 30 hours later, he almost kills his sister, and they end up at Angel and sewing them back together again. And so it was an enlightenment of me that, wow, what are these these once a month heartworm preventative doing? And I went to one of the first lectures, probably in the mid 90s, on milbemycin, and ivermectin and stuff. And what came up at that meeting was they when they were talking about it, they said it was a drug that was used in Japan. And the side effect of that drug killed parasites. And it wasn't very good as a drug, but it killed parasites. So I raised my hand. I said, what was it used in Japan for? And it was an antibiotic for the intestinal tract. So in my mind, all of a sudden things started to click, and it was like, oh my God, we're wiping out his microbiome. We gave him this microbiome, then we gave him something to kill it. So now it's completely imbalanced. So this is 10 years ago. So I see it, but I hadn't had a clear case of it till today. And I want to share with you the case that I have been presenting to Angel Memorial right now. I have sent this case to them. It's their case. The owner says I can talk about it. I shared this case with you guys a few months ago, or a few weeks when we did it, but this is a new thing that has happened. So this case, Doug, who I will show you the case, has been doing great until they gave him Simpartica Trio, and he now has his serious diarrhea back again. So let me show you his case. I will share the screen.
I might have to
disable something.
No, I'm going to make you the host.
Okay.
Or
just make me the host for a second, and I'll send it back.
Here we go.
Okay. Okay. So share screen, and we'll do this one here. Okay. So you are sharing your screen. So we're going to do this, and I got to do. Take this down a little bit. Slideshow. Play from current slide. Okay. So this is Doug. Okay. And Doug was suffering from, let's see, 1 second. Let me just 1 second. I think I go to the last slide or the, okay, got it in the first slide. It's not showing up. This whole picture is only showing up part of it. Okay, well, anyway, I will do it from here. Okay. Okay, present, play from current slide. Okay. So we're covering up Doug's picture on the side with all the people's faces here, but he's suffering from diarrhea going out 5 times during the night and 6 to 8 times during the day for 9 months. Okay. And okay. So here's the notes from Angel. Early history had on 4/1/21 had a DHPP, rabies, kennel cough, Lyme, lepto, and these are the dates that it had it. Okay. Presented at Angel, but obtained from the breeder at 6 months and had diarrhea. Original veterinarian had started on metronidazole, parental fecal test, food isolations, probiotics. New fecal showed giardia, crypto, so they started on Tylen, Verbantal, probiotics. Diarrhea was better for a few days, then returned. Dog is lethargic and questioned reinfection with parasites, IBD, and Addison's. Was given metronidazole, Panacur, Hills, WD. So on July 28th, 21, diarrhea was still present after eating some chicken. We have to move these out of the way. But back again, it went on to WD, and it was on Simpartica Trio, which is the last part, which is being covered by these. Let me see if I can get it.
No, everyone can see it.
Everybody can see it. Okay, okay. So here the dog is on Simpartica Trio. Okay, on August 11th, he continued diarrhea, now has an ear infection in both ears, and went home on Drontel, Tylen, and WD. And then on October 2nd, 21, continued diarrhea. We're talking about 6 to 8 times a day and 5 times at night. So it started on a Tylen again. What's the other? And sulfasilazine, which is like a sulfur drug. And nothing was clearing it up. On October 8th, 2021, continued diarrhea with Tylen, helped slightly, but now has anxiety, which is related to, I think, getting rid of the microbiome with all these drugs. He was started on again, sulfasilazine, Purina OM, Bisbiome, started on Prozac, but the owner did not give the Prozac. And they recommended fecal microbiome transplantation, or FMT, in 4 to 6 weeks after the antibiotics have cleared the infection. Okay. So this dog had 2 fecal transplants with full anesthesia. The patient was sedated and placed in sternal recumbency, and 50 grams of fecal material mixed with saline was strained, and approximately 160 milliliters of solution was instilled into the colon via an enema using a 60 cc syringe and a red rubber catheter in this position for 45 minutes following the enema. Had 2 of them, okay? The first one, they got a little bit normal stool and didn't have the diarrhea through the night, but still had 6 to 9 times during the day. The second one had no change, and the diarrhea was back 5 times at night and 6 times during the day. So neither one of them fixed the diarrhea. What was the difference between the FMT at Angel and the MBRT that our donors do? Okay. So with our fecal donors, we have the 4th, 5th, and 6th generations of dogs that have been protected from antibiotics, drugs, over vaccination, are on organic food. We don't expose them to antibiotics, pesticides in 29 years with 6 generations, and they're naturally reared with an organic home and vaginally birthed and nursed until at least 12 weeks. So, the owner, made a comment about how this transplant didn't really work, and they went through this whole procedure that didn't work. Okay. So when we do our fecal transplants, we add ozone gas to disrupt the biofilm. We use 24 micrograms of per milliliter of ozone to reduce the biofilm. And then we put about 40 cc's of slurry. They put 120 cc's, put the dog under general anesthesia, kept it under anesthesia, didn't work. Okay. So they also did a bunch of, an analysis from Texas A&M at the GI laboratory. And this particular test in 2014, we donated 100 samples of my dogs generationally to Texas A&M for them to develop the dysbiosis index. So our microbiome corrects the dysbiosis index according to the research that was done at Texas A&M. This was the nutritional plan that I put the dog on, right, to maintain the dog and to maintain the microbiome. And we tested the dog for Plechner syndrome. And and he clearly has Plechner syndrome. So he had a very, very low IgA, and it's hard to see, but that was 56 is very, very low. Anything 58 or below is considered very low. And his thyroids were weak, and his adrenal estrogen was quite elevated, and his cortisol was elevated, but it's ineffective cortisol. So this is sort of what we charge, just to sort of see what our costs to charge the owner. I'd put this in there because we were giving this to other veterinarians. Mm-hmm. And the original visit from MASH was virtually done on 1/5. And at that time, we stopped all the medications, and then we gave him because he was on medication, we gave him a fecal transplant on 1/8/22. And he had no nutritional support started with rabbit and some low estrogenic veggies like zucchini and fruits like blueberries. A slight bit of nausea from the stomach in the first 2 weeks, but no diarrhea in this dog the next day. Okay. From one day to the next, by doing the way that we do the fecal transplant, this dog has had no diarrhea, and it's been going on since 1/8 when we saw the dog until yesterday. Wow. We had a glacier peaks to just sort of look at some of the foods to try to avoid in there. Okay. And some of the foods that are inflammatory for this particular dog. So in the owner's own words, they were getting no sleep for months. We felt terrible for Doug, who's the sweetest, kindest dog and was suffering so much. Then he started vomiting as well and couldn't keep food down. And we tried a 6 weeks trial of metronidazole. As soon as we stopped the treatment, the diarrhea returned. It's completely liquid. We finally were recommended for a fecal transplant. At first, it seemed like a cure, but that was only it stopped the diarrhea at night. So they were at least having the diarrhea free at night, but still during the day. Okay. And then it returned with a vengeance. So we opted for another fecal transplant, and it was Christmas holiday, and we took him outside 5 times, 11 times at night. After the second fecal transplant, we had diarrhea return within a few days. It was awful. So there seems to be no hope for this adorable dog. And We hadn't ever had time to really enjoy him since he came to us. Okay, so we went on the power of microbiome when it's done correctly. We went on a search to find the solution and came upon Dr. Margo Roman. As a pharmacologist in the field of infectious disease for 22 years, I understand and appreciate the role of the microbiome in health and how an imbalance can cause diseases. As I watched her videos and became more convinced that her comprehensive approach and focus on the raw diet, ozone, vitamins, and minerals, along with replacement, this time from healthy donors raised without antibiotics, and including oral microbiome capsules, would make a difference. I'm happy to report that Dr. Roman's approach has been a true miracle for Doug's family. He has not had a single episode of diarrhea since the transplant. It's a different experience. Now Doug eats fresh organic food and continues oral microbiome support for his microbiome health. He is a new dog. We are very grateful for Dr. Roman for giving Doug his life back and giving us his family giving us happiness in our family. This was his first stool after having liquid diarrhea for 9 months, So I've shown these slides, and this is Doug, and he was getting nuggets of poop to help him settle his stomach. So I got a call from them or emailed this morning from them that his diarrhea has returned. Okay. And they informed me that because of the ticks, and now in Massachusetts, this is tick season. So it usually is the worst about the 10th of April, which is like today. And it goes on till about the middle of end of June, beginning of July. So they put on Simparica Trio. And in the past history, this dog was getting Simparica Trio. So was that knocking out his microbiome every month? So he never could get ahead. As soon as they gave that to him, he was back having diarrhea and could never really rebalance himself properly. So until he had our fecal transplant, but they hadn't used any tick stuff on him for the last 3 months. So we didn't kill off what we put in there. Now they use the Simparica Trio, and a day and a half later, he's having massive diarrhea again. Oh. So this is a very important case. And I think that we can sort of show this when we go and look at some of the information coming from, some of the research. There's a research paper that is also in this, let me get that thing. This is updated use. So this is a paper that Jean Dodds sent me, and she's involved in it as well. And she gave me a summary. I sent her Doug's case. And of course, she sent me back this whole review of Simparica Trio this was about 2 months ago. And I, hadn't thought about that component until today, because he hasn't been on any flea and tick products because it was during the wintertime. And that may have been that's why we were so successful, is we weren't toxically killing his microbiome every month. And so this poor dog would maybe get a little bit better, and then they'd go blow it all out, and he would just blow it all out. So when you look at this here on the different reactions, and we look at Simparica Trio, they've had 1,454. I mean, it's crazy.
Where are you staying?
Right over here, a Simparica Trio. Can you see that?
No, we're still on the slideshow.
Oh, sorry.
It's okay.
Oh, sharing. You're sharing. Okay, I put it on this other thing. You're not on screen share? Okay, 1 second. How did I do that?
You're sharing it. It's just on the
Let me go shut the PowerPoint off then.
Okay.
Let me see if I can get that's covered the screen. You want to save? Don't save. Okay, 1 second. Oops, sorry. So if we share screen again, and we put this was a response that I got from Jean on the case, and she released gave this to me. As of April 17th, 2021, the USDA released adverse reactions for all these products. Leading the list is Simparica Trio, with 140,646 documented adverse reactions and 6,707 deaths, followed by Trifexis, NexGard Spectrum with 190 802 adverse reactions and 5,998 deaths. Bravecto with 77,459 adverse reactions and 473 deaths. So we avoid spinosad, which is Confortis and Triflexes, Afluxlander, which is NexGard, Fluorolander, which is Bravecto, and Serolander, which is Simparica and Simparica Trio, as well as Lodolander, which is Credello for flea control for ticks. So we also recommend avoiding Maldexidrin and Middlepride, which is Advantix Multi, ProHeart 6 and 12, Cymethylene Revolution, Cymethylene plus Serolin, Revolution Plus, and Maxodextrin, Coraxic, and Milbamycin oxamine with Luferanol, which is Sentinel. And please avoid the Seresto collar. Recently shows it causes seizures, deaths, and unprovoked aggression, warning on the label. Wow. Okay. So these are things, this study that she showed that she had. Now, can you see this? If I take this to, no, that's not it. I take this to this. Can you see this chart?
No, we still see the Word document that Jean.
So that I got to do, shut the Word document off. Where's the Word document here? Shut that off. Want to save, okay. Oops. And then I got to go back into.
I've used a few of those. I've used over the course of owning dogs, Frontline, Advantix.
Yeah, I mean here, but this is a study that was done. Now, can you see this thing?
No.
Research IM Med.
No, I think you have to share your screen again.
Okay, one second. Share screen. Okay, one second. Here it is. Now, can you see it?
Yep.
Okay. So this is the Journal of Veterinary Medicine and Surgery. And this is a paper that was done by Dr. Dodd and Kimball. And the objective was to develop a novel potent flea and tick preventatives and this is just an introduction, but what it is to show what the adverse reactions of all these particular flea and tick products are, right? And I don't think anyone's addressing the microbiome on it. But if you have a drug that does the kinds of things that these drugs do, it's got to be affecting the microbiome, okay? So this is a chart I was showing you about the number of animals that have the reactions and deaths and adverse reactions that these animals have had. So the one that she sent me was sort of a summary of this particular thing when we were talking about Simparica Trio. But that to me is we got to pay attention to this. If we're killing that microbiome off in the chase of trying to kill the parasites off. So back to this article. One second. That's not what I want. I got to go back here. This one here. Go down here. Let me go shut this off. Sorry, guys. Go back to here. Your screening. Okay. What do you see now? That's still that chart?
Yeah.
That article? Okay, I've got to learn how to shut that off. This is you still see this one, so I close that. Now, okay, so then we share screen, and I want to show you this one here. Okay, so these are some of the things that the heartworm preventatives, what they're doing, or what these flea and tick products with heartworm preventative are doing. NexGard, which is the one that they banned, they don't want you using either, is this afloxacin, which is a member of the isozolazine family, shown to bind at the binding site of inhibit the insect and acrin's ligand geta chloride channels, and particularly those gated by neurotransmitter GABA, where the blocking of the pre and post synaptic of chloride ions across the cell membrane. Prolonged affluxander-induced hyperexcitation results in uncontrolled activity of the central nervous system and death of insects and acarans. So what they're saying is a selective toxicity between insects and acarans and mammals may be inferred by the differential sensitivity of insects with and the acarans or acarines, GABA, so this is more complicated biochemistry. Point of it is that microbiomes have similar kinds of mechanisms of action. So we're killing off those too as well. Same thing with Brovecto. It's affecting the GABA, GABA aminobutyric acid receptors and glutamate receptors. So it's affecting that. And Simparica, which is the Sarolander, is also inhibits the function of neurotransmitter GABA butyric acid. And so these are all part of the microbiome. And I don't have the details of what microbiome are being affected, but we are not helping keep ourselves balanced by making our animals a no pest strip for a month or 6 weeks or however this material stays in the system. So to me, it's really scary, because how many years have people been using this and killing off the microbiome? And it takes years to get that back, if you can ever get it back. And that's the scary part, is that, you think you're just doing this to get rid of fleas, or ticks or heartworm. And at the same time, you're killing off the gut flora, and you may never get it back. That happens with antibiotics. You go on antibiotics, it kills the microbiome. And they say that one course of cephalexin can take your microbiome off for the rest of your life, or for 1 year, So nobody knows how long this stuff takes to come back, if it at all can come back, because this stuff is in the system for an entire month. So if that microbiome is trying to regenerate itself, it's just getting kicked, just like it's kicking the fleas and kicking the ticks. So I think that this dog was doing great, and then started to have a little nausea the last few days, like the last 2 weeks has been having a little bit of nausea. And I think that because it has Plechner, its immune system is weak, and it was starting to get weaker, and then had that Simparica trio, threw it back into the diarrhea stage. I mean, acutely transitioned right back into that, because that killed off its microbiome. So I've been, not wanting another case that really clearly shows we're going along here, going a little bit down. Then all of a sudden they get some type of flea or tick or heartworm preventative, and they drop through into the past, into the bad negative side of having chronic diarrhea. But the owners, they don't want ticks. So what do we do? The ticks are there, and the ticks will still give the dog Lyme disease when they have all these products on them, because they can be transmitted, they're saying, sometimes in 4 hours. And many of these take at least 12 to 24 hours to kill the tick. So you'll find the tick dead, but at the same time, you're killing your dog's microbiome. And if microbiome is 80% of your dog's immune system, what are you doing to their immune system by killing it off with a heartworm preventative mixed in with all these flea products?
Dr. Roman, are you able to end the screen share? Or do you need to share more?
No. Okay, I'll end the screen share. You are in screen share. Stop share. Okay, sorry.
No, you're absolutely right. I mean, and you and I have done a live before. I don't know if I think it was over a year ago, on heartworm, and you explained how, you save your dog's microbiome when you give it back to them after you give them the heartworm pill. I personally don't give any kind of pesticide, period. No heartworm, no flea and tick, nothing. And, it's always a big topic of conversation, because you're going to, yes, Lyme disease and heartworm are extremely serious and can be fatal, right? But you still have to consider the microbiome and how important that is. And
absolutely. So, like with my dogs, what I do is they get their fecal checked every 2 weeks. So we check and make sure they don't have any parasites. And then what I do is, there's a product that was called Safe Heart that was on the European market for many years. And it was about 1/3 of the dosage of Inaceptor. And so I'll give my dogs 1/3 of a dosage weight wise of a pill of Interceptor, which is only, it's not supposed to be high enough to kill the parasites in the intestines, but enough to kill the microfilaria or the life stages of the heartworm. So I give my dogs that smaller percentage or that partial part of or you have a dosage for heartworm, and then I hold their stool. I get their stool, hold it for 24 hours, and refrigerate it, and then I give it back to them because the Interceptor is supposed to clear 9 to 12 hours. So, my thought is it's gone through the system, and I wait 24 hours because I want the microbiome to still be real viable, and I give them their poop back.
How do you
doing that for like 7 years now?
How do you give it back to them? You give it in a capsule?
Because I have time to make the capsules, I just shove it down and give them a bunch of cookies before, and then put it down their throat. And so, and I only do it in Massachusetts because, we don't have mosquitoes year round. But those of you that have mosquitoes year round, the heartworm is a big issue. But, a bigger issue is autoimmune disease and cancer. And that's what the microbiome is protecting these animals from, and if you're killing that off when you're doing your, trying to prevent heartworm, and, in the South, you need to do it. It's prevalent. It's not up here. It's not as prevalent. So people need to know that component when they start to think about how they want to prevent these things. But I think that doing these combinations of all these different antiparasitics is not good. You're hitting those microbiome from all different angles. And I think it's really bad, actually.
Yeah. Yeah. And, so we're going to open up this for some questions in a few. We have a few people on here and some people watching live on Facebook. So Diana, Jess, Shelly, Tanya, if you want to, you guys can feel free. I'll unmute you guys. And if you want to ask a question, Dr. Roman, you're the host. I don't know if you can make me the host again.
How do I do that?
Go to my name.
Your name. Okay.
Click more and then make host.
Make host. Okay. Got it. Change host. Okay, good.
I'm asking everyone to unmute. You don't have to, but if you want to ask a question with your audio, feel free to. So yeah, I don't, it's pretty serious, heartworm and tick-borne diseases. And I made a video today for somebody who came into the group, a new member, and asked about, what do you use for, to prevent, fleas and ticks. And I made a 14-minute video. It was just easier for me to do that, to do it that way. And I explained what I use, and, I explained that, nothing is 100% effective. I think it comes, I think one of the biggest things one of the biggest problems that I run into is that people are not having access to the microbiome from your dogs. And so they're, after the heartworm out of the flea and tick pesticide or whatever, they're going to just give like a 14 strain probiotic and think that that's, enough. And, it's not, unfortunately. It's going to, how much is the flea and tick med or the heartworm med wiping out versus how much is that probiotic replacing? And, I think you can run into a problem that way as well. So I think there just needs to be more veterinarians doing this MBRT, and people like, I'll come to your clinic on the weekends, and if I'm there, I'll take a bag of poop. It's good for the dogs.
Well, yeah, no, it is. It's just that it's not available everywhere. It is going to be available. We are definitely expanding our ability to give it to more people. We've got Animal Biome, which is the main tester for microbiome. That we've been shipping out to them our microbiome for our dogs for the last 4 or 5 months, and they've got now inventory and are now selling it to veterinarians. And the veterinarian has to request the Dr. Roman's microbiome from her dogs. But they now have enough stockpiled that they can be somewhat reliable about it. So we are going to they're starting to let people know they have it. Another company called Novel Biome, based out of Canada, is also going to be utilizing our microbiome. So we're seeing really great results with our frozen capsules and slurries. And the hope is that the freeze drying process will still give us the diversity we need. And again, each time you work with the gut flora and you freeze it, or you manipulate it, how much of the species do we lose in the processing of these products to make them available to other people? Obviously fresh is the best. Doing it really live and fresh is, to me, the best, but people have to go to a location that has fresh microbiome. And 3 of my puppies have gone. One is in Los Angeles with Dr. Audra McCorkle. The other one will be is in Ashland, Oregon. And Eve is in Los Angeles, and Blueberry is in Ashland, Oregon, and is going to be helping several veterinarians in the Oregon area. And then you mentioned also Jerry Bukoff, and one of your things, he's got one of my puppies, little Cilantro, and he's going to be doing live transfers. So there's and actually Kathy Backus, who's in Kanab, Utah, has one of my puppies from the litter before this, and she's doing live fecal transplants. Okay. So there are places around that we can get them, but we're going to start having the AHVMA is now added fecal transplants to their list of modalities that the veterinarians are using. So people can find a place where they're doing fecal transplants on the ahvma.org website. So they can look for people that are doing that. Not all the vets know that has gone up, and they can put their name on it. So it's because it just happened this week. So there may not be a lot of them up there because they don't know it's available to put up on their website.
Well, hopefully they stick with this, the same level of care, meaning like the diet and the no antibiotics and things like that, in using ozone in place of antibiotics, or just using them judiciously, because you haven't used them in 29 years.
Right, on my dogs, if I can avoid using them on my patients, I completely avoid using them on my patients too. I don't just willy-nilly put somebody on antibiotics because I can't think of something to do. Right. So that's something that, owners need to be very, very careful about their veterinarians recommending antibiotics, because the AVMA in 2020 had a whole white paper and a whole discussion for like 250 pages about being judicious about the use of antibiotics. But I think they're going to need to go into this whole flea and tick thing, because if that's destroying the microbiome too and causing resistance because of the microbiome being distorted, then we need to be really getting our veterinary administrators to pay attention to this.
Yeah, Dr. Becker and Rodney did a 2-hour podcast today in the Inside Scoop, their private group, with Dr. Judy Morgan on like exactly what we talked about today. So
great.
A lot of people are talking about this now, and I think everyone's wondering like what can I use, for.
I know. Well, the natural things. I mean, what you use, you just put in your thing, where we use the amber collar, the bug zone. The amber collar is a raw amber, is used in Eastern Europe. And when I was in Romania, I don't know, many years ago, I bought a bunch of amber, but there's a woman, amberstonepets.net, who makes beautiful collars. And there are other companies that are making the amber stones. And they are, that's supposed to deflect the ticks, because the amber comes from a tree and it's fossilized. And the idea is that sap that is fossilized, when it's rubs on the dog's hair, produces an energetic field that's picked up by the ticks, and they think it's a tree. And then there's the bug zone, which I think is a similar kind of thing. It looks like the thing that you put on your keychain that when you scan it in a grocery store, and it hangs or is attached to the collar, and that has that. And then I use the Flea Free in the water, which is the Green Hope Farms flower essences. And I still get ticks. I mean, let's see, I saw so far this season, I've had 3 that have fallen off in the house, and I pulled off about 6. And I have 7 dogs that are long haired, and they all got shaved down last week. So they're all, it's great. I can just go instead of, like spending 15 minutes on each dog. Right. No, it's really nice to have a hair shave.
I said it earlier, I think the number one thing you can do is just when you come back from the woods, check your dog immediately. Check them, rub your hands through them. I keep a lint roller in the car. So I'm like, seeing if I can pick up anything.
Yeah.
I when I
It's hard when you have, long-haired curly dogs. It's
for
just
sure it is.
very challenging to do it. And so, I'm going to miss them. I know. And that's where what I feel about it. And again, I feel I keep knocking on wood and feel very, very fortunate that my dogs have been positive for, off and on for Lyme for 30 years, but I've never really had to treat them. They just have adapted immunologically, whether their gut is just protecting them. But I think that's a big component that we really need to look at, because if we're keeping them on heartworm year round at the full dosage, are we jeopardizing their immune system because we're giving them antibiotics once a month? And that is a very scary thing.
Yeah, it is. It really is. I so I also, if I remove a tick from one of the dogs, as you know, with Allie, I could literally do anything. I would find a tick, I would give her some subcutaneous ozone right beside that spot. I put some ozonated olive oil over the tick bite, give her homeopathic ledum. I'd be, but if I tried to do the ozonated saline under subcutaneous shadow, he would start screaming. So I have to learn to okay, I do the ozonated saline, like ozonated olive oil in my fridge, have my ledum homeopathic in the cabinet, and I do the best I can there. But give them rectal ozone. So I really, I was said to somebody the other day, and I made a big post on ozone therapy and O3 vets and how I love their cost. I talked to Jonathan the other day. He's sending me a new regulator for my tank because it's not working right, and I rely on my machine so much. I use it several times a week at least, and I can't imagine not having one.
Right.
So it's
it is. It's a wonderful tool to have for, just so many different things. Anyway, we can go into a whole lecture on ozone again, but I really wanted to focus on what everybody's panicking with ticks right now. And what are we doing? We're putting all this stuff on our animals, and are we setting them up for a real failure of their immune system? And I think that it's just so bad now. It's so bad. There's so much cancer. There's so much autoimmune disease that never was there. And we have had these, once a month heartworm pills for about 25 years. And so the increase in cancer has accelerated in that time, as well as the use of glyphosate in the last 25 years is accelerated, and it's in everything. So between having glyphosate or Roundup in the food chain and having this Flea product, what are we doing to this treasured, million-year-old microbiome? We're literally throwing landmines into its existence.
Absolutely. Jess, I see that you're on. Thank you so much.
Hey, how you doing?
Good. Do you have a question for Dr. Roman?
Yeah, I kind of, with we had the pup with nasal osteosarcoma and seizures, and she did pass in November. So back then we were so focused, or I guess I was focused on seizures and cancer. Some of this other stuff I haven't really focused on so much. But now that we have a new member, this is Diesel. He's about 11 months intact still. So we're kind of trying to do the best we can. So actually the vet here in Kansas City, she's actually consulted with you, Dr. Roman, but I was wondering, we had the antigen test, the heartworm antigen test done last week.
Okay.
When should the microfilaria test be done? She said what's great about her is she's absolutely willing to do anything we want. She's just, we just have to ask the questions. We're in the Midwest, Kansas City.
Yeah. Okay. So the dog you said is how old now?
Well, we have two. He's about 11 months. The other one is 6 years old. She's a little pit bull, and we haven't had any topicals or oral for her for over a year. When we started our journey here.
Okay. So the heartworm takes 6 months for the life cycle to show up as a microfilaria. So what happens is the mosquito hatches and it flies around for about 21 days. And then in that time, it bites a dog that has heartworm. and then it goes through these filarial changes in the mosquito, and then the mosquito bites another dog, and then it takes about 6 months before, through the life cycles in that dog, to start to generate microfilaria, because you have to have the worm mature, and then you have to have a male and a female.
Okay.
And if you only have a male, you're not going to get anything. If you only have a female, you're not going to get all these babies. So you have to have both a male and female to pick up the microfilaria, which usually takes about 6 months for that life cycle to occur. And that's where the heartworm preventative, when you give that, if it got bitten, let's say on, there's the mosquito hatches. So then it's 21 days. And then the heartworm works for the last 30 days. So now you have 51 days that you need to give your heartworm pill if you live in the north where we are. So I usually tell people, you see a mosquito, start counting. At least you could wait 30 days or 40 days, but then start at that point, unless we get another freeze. So if we get, like in Massachusetts, sometimes we can get a snowstorm in the middle of April. Anything that hatched out before that now is dead, because it was a snowstorm. So you got to assume that you can start counting again your 21 days and then your 30 days. So, but that heartworm, if you test your dog for the filaria and it was born during the winter time and didn't get exposure, it's got to get exposure to that mosquito and have a chance to incubate for 6 months. So depending on when that dog was born, what part of the season it was born, you may not be able to pick it up, because it wasn't exposed as a puppy, being in a house, not getting any mosquitoes, versus being born outside in the woods and getting mosquito bites right as it was born.
Yeah. Okay. Yeah. Cause when we got him back in November of 21, and he had received, the typical vaccines and the heartworm and everything at that point.
So that should have intercepted it, because if he got exposed and there's 2 or 3 larval stages that at any point during those larval stages, that heartworm preventative will kill the microfilaria. So that's why they want you to keep giving it. And, the companies want you to give it year round, because they sell 6 more months worth of medication. But if you live in the north where we do get snow and a lot of cold weather, there's no reason to keep them on it year round. Okay.
Yeah, his dose he probably got a dose in September of October of 21. That's the last time he's had it. Okay. And we just had a refreeze back up here last week. So I think it's the other pup I'm concerned about, because she's outside a lot and 6 years old and like kind of been off.
So, if you're not going, I recommend my clients still getting heartworm, but I have them do the lower dosing. Okay. And I don't have them do it year round, unless they go to Florida or something. So if the client is, travels for the, to south for the winter, yes, they have to keep them on it year round.
Okay. Thank you.
Awesome. Thanks, Jess. Your dog is super cute too. I saw her in the background.
Yeah.
Is that Diesel?
That's Diesel. Yeah. Where are you? Here, buddy. Handsome. Yeah. I think he's got a big old snout, and the way he sounds, I think he's hound and black lab.
I thought at first he might be part Dane. He looked like
a
Dane,
Yeah,
so have him checked. See what he. It's always fun to sort of get that DNA and go. I had one the other day. Oh my God! I wouldn't have been able to tell what it was. It wasn't what it looked like at all. I wouldn't have picked those breeds out, but it somehow made it that way.
Yeah, he's kind of tall and skinny, so yeah, he might be. Yeah.
So I thank you so much, Jess.
Thank you.
All right, doctor, we have a couple questions from Diana in the chat. How can we figure out the lower dosing for our dogs that Dr. Roman recommends for heartworm?
So what I was told, and I've been doing this now for about 15 years on my own dogs, and my clients who don't want to give heartworm preventative, I still don't want them to get heartworm. So I give them, let's say if my dogs weigh about, let's say they're 50 pounds, they're a little bit less than that, but they're 50 pounds. So if we're going to give 50 pounds, the large heartworm preventative is 50 to 100 pounds. So you definitely don't want to get that dosage. If they're 50 pounds, you want to go to the less dosage, right? So if we give them maybe one of the 1 to 25 pound dosages, or, then you could give them one of those, and that would be about half of the dosage. So instead of going to the 50 to 100 pound, if the dog is 50, go to the 1 to 25, and you'll be giving half that dosage.
Okay.
So it's just that they say don't break the pill in parts. I've been doing that, but they tell you not to, because it's not evenly distributed into the tablet. So if you give a half a pill and it all got squirted into the other half, it may not be an exact thing.
Thank you. Diana also asks, she said, I did a fecal transplant to my dog. She has lots of things going on, but one thing is the hyperkeratosis on her paws. Once I did the MBRT and it cleared up, but now it's back. I'm saving up for more MBRTs and getting her insured in hopes that they may cover some. I use Healthy Paws and it does cover the fecal transplant. And I'm not sure about others. What else can I do to get rid of the hyperkeratosis? Is it painful for dogs? Thank you.
Well, I've not treated hyperkeratosis on the paws with the fecal transplant, but I've treated dogs with severe, alopecia and redness and thickness of the skin and all that. But, we know that the microbiome has a direct link to allergies, direct link for inflammation. So if this is hyperkeratosis is sort of an inflammation of the epithelial layer that's causing this thickening of the skin. So, wherever we can use the gut, this is my feeling, and it's been like that now, because I just keep getting shocked by some of these cases that just turn over in such a positive way. So getting the microbiome and getting the fecal and giving them that diverse microbiome, I think is just a way to balance out the animal as quickly as you can, versus trying to just keep building it up with herbs and building up with this. If you don't have a good microbiome, you can use a lot of herbs, but they can't get metabolized because you need that microbiome. So if you could focus on trying to get more of the, microbiome restorative therapy, and I'm stopping the word, I'm not stopping, FMT, which is fecal microbiota transplantation, has been the term since 2010. But in 2012, I coined the word microbiome restorative therapy because I think it's a much better term, because we're not just giving poop to dogs, we're giving the restorative combination of nutraceuticals to support that microbiome, as well as a really healthy microbiome. It's not just putting poop into another animal or person.
Yeah, because there's so much that goes into how you care for your dogs and how much you invest in your dog's health that benefits the animal that they give the poop to, and then also supporting the recipients before they get the transplant, and then maintaining it and support after. It's just so much. So I really like that term. Great. Yeah, thank you for the question, Diane. Shelly, I saw that you had unmuted yourself, but the noise was affecting the Margo. Do you want to unmute yourself now? And if you had a question to ask? I just asked you to unmute. I don't know if that was on purpose or not, but this has been very informative. Thank you. I don't think she might not be at her computer. If she unmutes, she can ask. Well, this has been great. I don't see any questions on Facebook, but I can check one more time. Did you want to talk about anything else before we log off?
Well, I think that, this is I think this is something we need to be really talking about all these drugs that we're putting on our animals, meaning, pesticide types of drugs that we're forcing our animals to be living like that for so many years. And it is detrimental. And so, if you have fleas and you have ticks, there are ways that you can try to mitigate how extreme they are, but you're never going to stop having, ticks. We're going to blow our earth up if they get rid of all the ticks. Absolutely. So, using things like cedarwood oil or, the neem powder, there's other natural ways to try to reduce the exposure, but ticks, they are attracted to the energetics of that body. And so that's where, they're sitting on a blade of grass, and they may be sitting on that blade of grass all, since last winter. They went into hibernation, they came up to that blade of grass, and they're sitting there like this, waiting for something to come by, and they may not have eaten for 2 years. they can live like 2 or 3 years without anything. So, are you going to stop for a smell of, or a pesticide? You're not going to stop. You're just going to go and go for it, because you may not find another dog running by your blade of grass.
Oh man, 2 years. That's some serious fasting.
Yeah.
We got a couple of comments and questions from on Facebook.
Okay.
Judy from Singapore. Hey Judy, she says, we do have lots of mosquitoes here in our country. I do not do any flea, tick, heartworm meds, but I'm doing heartworm testing every 6 months. By doing testing every 6 months, will it help me to figure out if I need to do something if heartworm is detected?
Well, yeah. I mean, by frequently testing, you'll know your dog has heartworm within that 6 months. The issue is when your dog is positive for heartworm, it's then contagious to other dogs. So that's not a responsible thing to do. It's like, I don't care if my dog's positive. One, it causes heart damage and can cause the dog to die from heartworm. And two, it spreads it to the community, and makes it more, all these other dogs that would be getting it. And three, they do find it in people. It is not a normal, it's an aberrant host, people are, but it's meaning that people can get bitten by a mosquito that has heartworm, and that microfilaria never reaches maturity, but forms a cyst within the lungs. That is, if a person gets a chest film, it can be misinterpreted as lung cancer. Mm-hmm. And they have to go through a lung biopsy to find out they have heartworm migration, which is yay, but and it doesn't hurt them, but it sure is scary to go through a lung biopsy if you don't need to.
Yeah. Tina wants to know, hey, Peter, this is Tina. I only live about an hour from Jess. I do have one question for Dr. Roman. For a dog not on any heartworm preventative, how often should you check for heartworm?
Well, I tell people they should check twice a year if they're not on heartworm preventative. So definitely in the spring, because what you don't want is your dog to become an infected, source for all the dogs in the neighborhood. So if the mosquitoes come out and your dog is loaded with heartworm, those mosquitoes are going to be infected for 21 days and be biting everybody in the community. So that's not responsible. And then at the end of heartworm season, in like 6 months, halfway through, if the dog got bitten and you can pick it up early and know that the dog has it, you can try working on getting rid of it before the spring starts. And there are some natural ways of trying to get rid of it, in combination with ivermectin, which has been used to get rid of it too. And I use ozone and UVBI and the ivermectin.
Awesome. Dr. Judy says, Dr. Roman, this is Judy in Singapore again. Do you consult internationally?
I can, nationally, I try to have a veterinarian working with me. Internationally, as long as I can't practice in Singapore. And so love to help collaborate with your veterinarian. Then, by collaborating with your veterinarian, the hope is that they'll have a little bit more access and knowledge to dealing with microbiome and dealing with that. And then they may, by you making that connection, they may then be able to help another dog with a similar or something not as similar because of the knowledge that they've gained helping your pet. Gotcha.
That makes sense. Now, I get this question all the time. I know I always tell people you consult with veterinarians because you're going to, then that veterinarian can help thousands and thousands of other dogs as opposed, it's just smarter to do. But now when you're on the consult with that of the veterinarian on Zoom or the phone, can the pet parent join in as well?
Yeah. I mean, usually the pet parent's paying for it, so they're paying the consulting fee. So I think they should be able to at least be part of it. Sometimes I have the client on there with the veterinarian. Sometimes it's the veterinarian wants to have a fast discussion with me, on how I'm doing it, what questions they have to ask. And, then I might call the owner back and consult to them directly after I've talked to the veterinarian. But I loved it's if you can't find a veterinarian willing to think outside the box slightly, then it's going to be hard to convince them to do something different than the drugs that they've been using. Right. So, if you have a veterinarian that's not interested in it and doesn't want to look at it, find another veterinarian, find somebody else who's open to trying another way of doing something, because they've just I guess their brain is full. They can't add any more information. And that's not a good veterinarian to me.
Oh, sure.
No.
I know it's not always that easy for people, when, sometimes their options can be very limited, or
Right.
a veterinarian that does ozone could be like 2 hours, an hour or 2 hours away. I mean, I would do an hour, but
yeah, no, it's hard. It's hard. That's why my hope is the more we can, reach out to veterinarians, both new veterinarians, students, vet schools, it's a positive. I gave a lecture on ozone and fecal transplants in Japan 2 months ago, and they are going to get ozone generators for all the military bases in Japan, American military bases, and start doing the microbiome stuff. So it's very, very exciting, and once they see the way that they can help their animals, it'll hopefully be able to be part of all military bases around the country. That why not have these very expensive dogs that help guard our military bases be as healthy as possible and not be given so many drugs.
Yeah, for sure. All right. Well, thank you very much for your time. It's 8:30. It's been an hour, and I think we covered a lot of ground. And I think this was a nice. This live was complemented what was done earlier, my video, and then also what Rodney and Karen and Judy did.
Excellent.
I'm glad that everybody's talking about this. It's a lot of information, but I think it was it's very important to get this out there. So thank you.
And thank you. And I thank Doug, because Doug, this beautiful standard poodle with all of his complications are helping a lot of other people learn.
Absolutely. And if anyone wants to check out Dr. Roman's pages, it's mashvet.com, microbiomerestorativetherapy.com, and you can learn all about the microbiome restorative therapy fecal transplant. And you can, I'll put the links, your veterinarian can consult with her, the MBRT request form. I'll put all that out there. And if anyone has any questions, you can reach out to me directly, and I will do my best to answer any questions that you might have after this, or for anyone watching it after the live. Thank you.
Well, thank you. Yeah. Okay. Take care.
Take care. Bye-bye, everyone.